Hello everyone, this is Dr. Ray Heiss at Revive Sport and Spine, your Cottonwood Heights, Utah Chiropractic and Sports Injury Clinic. This week we are diving into low back pain and what you can do about it, what we help you do about it, and how to prevent future issues. As we've kicked this week off with some exercises that you can do at home to help you with your back pain, I want to share briefly with you what the American College of Physicians has to say about spinal manipulation and low back pain. As we dive into these three recommendations from the American College of Physicians, I'm going to be completely transparent with you. One of the main reasons that this article came out was due to the opioid epidemic we have here in the United States. We way overprescribe for things like low back pain, neck pain, and other injuries like that when they can be treated conservatively in the same or less amount of time. The other reason I want to share this is because what the American College of Physicians recommends is exactly what we provide here in the office. So the first recommendation deals with acute and subacute low back pain. This is where we've had a lot of issues with the opioid prescriptions in the past and where a lot of things are changing. We know that with acute and subacute low back pain, if you give it enough time, it will go away. What we're finding is a lot of people would rather only have pain for a week or two as opposed to waiting it out and doing 4 to 6 weeks of just rest and let it heal. So the first recommendation they make for acute and subacute low back pain is spinal manipulation. The second thing they say is massage, acupuncture, dry needling. Things like that are going to be extremely beneficial to the person suffering from acute low back pain. So what is acute low back pain? That's something that's new, something you haven't had, something that just came on. Maybe you played golf yesterday or helped a buddy move or were on a long car ride or you bent down to pick up the paper and you felt a pop in your back. That's going to be that acute low back pain. That is something we're very effective at helping out and something that's actually recommended by the American College of Physicians. The second recommendation deals with chronic low back pain, something that you've had for 2-3 months or even longer. This is a huge problem in our country as well. Most people are sitting more than they ever have. We don't exercise as much as we used to. We're overweight. There's a lot of things that add into what we do as Americans that are causing this problem. Recommendations are pretty similar. At least this time, they bring in a lot of exercise. One thing I find with people that have low back pain is they're almost afraid. They shy away from exercise, thinking that it's going to hurt their back more. And that's actually one of the main recommendations for low back. Whether you read, any of the medical journals, any chiropractic journal, Professor McGill, who's a leading expert on low back pain research. Exercise is usually the number one thing to help you get through and prevent low back issues. So to continue with this second recommendation, they tell you exercise, yoga, tai chi, progressive relaxation, motor control exercise while bringing in spinal manipulation, dry needling, soft tissue work from a professional. Now there are going to be cases that are in this acute or chronic category that just don't respond to care. This is when we move on to the third recommendation. And I'm actually going to read this word for word of what they say on how you should use opioid prescriptions. Clinicians should only consider opioids as an option in patients who have failed the aforementioned treatments and only if the potential benefits outweigh the risks for the individual patients and after a discussion of known risks and realistic benefits with the patient has been taken under. With that, in our clinic, we bring people in and we help them through those acute bouts and those chronic bouts. We teach people the exercises they need to do at home. We get aggressive with it here in the clinic. Yes, we use spinal manipulation. Yes, we use dry needling. Yes, we're doing exercises with you. We have a massage therapist on staff that's going to help you with those soft tissue releases. Those things will help you get through. But if you're not responding in a realistic time frame, we're going to refer out to some of the orthopedists and medical physicians that we work with to take another look at this, to get another set of eyes on it and see if we can't bring things together and provide better care for you. At the end of the day, healthcare is a team trying to get you better and back to the things that you want to do. Our goal here in the office has always been the same. People come in for pain. We want to get you out of pain quickly. The second thing we want to do is figure out what caused it and what can we change in your daily life to prevent this from happening again. And the third thing is making you stronger and better than you were before. We can give you exercises, mobility drills, and other things like that that are going to help you get stronger, get more mobile, help you enjoy life more, and hopefully keep these from happening again. So as we wrap up this video, there'll be a lot more information to come regarding low back pain, different populations, some of the things that you can do about it. But if you know anybody out there that's suffering from low back pain, whether it be yourself or a friend, please share this with them. Share this information. We hope it's educational for you. We hope to never see you as a patient. If you ever do need our care, feel free to reach out to us online, comment on a video, send us a message, call us in the office, 801-944-1855, or you can find us online at revivesportspine.com.